Hey guys, Justin Brock here with Bobby Brock Insurance, America's #1 Medicare brokerage, and I wanted to come to you today and talk about Medicare enrollment periods. But first, just to let you know who I am, again, if you haven't watched the videos, I am Justin Brock, the Medicare guru with Bobby Brock Insurance. You can check us out at bobbybrockinsurance.com. Please subscribe to the channel. This is where we're going to put all of our best content. We have hundreds of videos about Medicare, some for agents and some for customers and beneficiaries, and I hope that you enjoyed this video. So hit like, subscribe, or turn on notifications for more information. Without further ado, let's get going. Medicare enrollment periods. There are several Medicare enrollment periods, but I like to do them in chronological order as they may affect you. So the first one we're going to talk about is called the initial enrollment. So initial enrollment period, IEP. Also, there's some called the initial coverage election period, and these kind of overlap in concept, but you don't really have to know the difference to understand when you need to enroll in something. So during the initial enrollment period, this is 3 months before, the month of, and 3 months after your 65th birthday or the eligibility date you're given if you're on disability Medicare. So, but going off of turning 65, if you were turning 65 in July, this would be April, May, June, July, August, September, and October. So anytime in that period, you were able to sign up for Medicare A and B, as well as begin to elect Medicare supplements or Part D prescription drug coverage or Part C Medicare Advantage plans. Now, we recommend to try to get that kind of stuff done before your 65th birthday typically, so that you can have all of your coverage in place by the time your Medicare is effectively starts the first day of the month you turn 65, or sometimes your Medicare actually starts the month before. That's when your birthday is on the first of the month. So that's our recommendation, is try to get that in place beforehand. Now, if you're utilizing the initial election period to get on Medicare, there's another period that we talk about that is different for enrolling in a Medigap plan or a Medicare supplement plan, and that is the Medigap open enrollment. So with Medigap or a Medicare supplement, you cannot get a Medigap plan or a Medicare supplement anytime you want without answering health questions. You have to answer health questions if you don't utilize your guaranteed issue right or your Medigap open enrollment period. With the Medigap open enrollment period, it actually starts 6 months before you turn 65 and lasts 6 months afterwards. We don't want people waiting until the very end, because what ends up happening is they get to the point where they can't get it effective before they leave that open enrollment period, and we often end up having to underwrite them because they're just a day or two past that period. In that Medigap open enrollment, though, you can get any Medicare supplement or Medigap plan without answering any health questions. Now, within your initial enrollment, if you enroll in A and B of Medicare, you can also get any Medicare Advantage or Medicare Part D drug plan. And there are never really health questions that go into that, aside from the question of do you have end-stage renal disease, which is waived during that period. So the other question, the other enrollment period that's important to note that goes hand in hand with this would be the general enrollment period. Now, this general enrollment is actually used for people who miss this period. If they don't enroll in A and B during the initial enrollment period, then and they don't have credible coverage elsewhere, then they would have to wait until this general enrollment period, which is annually from 1/1 of the year, whatever the year is, to 3/31 of whatever year that is. Okay, and during that period, they could elect to get, say they didn't enroll in Part B and they didn't have that person did not have credible coverage through an employer plan or something like that, then they would have to enroll in that Part A and B during that period, and it would be effective July 1st of whatever year that was after that. Now, this could cause them to get a penalty. So this is a safety net period that you can use when you needed to, but we very rarely have to use this because typically we advise people to use this period or this next period right here, the special enrollment period, okay, or we call it an SEP, okay. So this SEP or special enrollment period is for people who come to their initial enrollment, but they have credible coverage. They have a credible coverage. They have an employer or union coverage that is as good or better than Medicare and is deemed credible. So normally if you're employed like at Walmart or a bank or a hospital or anything like that, a manufacturer, they probably have a group plan that you can stay on, and that group plan would act as good as Medicare, and it's going to provide you with credible coverage. And you need to make sure that your employer coverage is credible, because there are some employers that are offering coverage that isn't credible either on the medical or drug side. But we'll pretend that you have one that is credible, and you decide, I'm going to wait a year before I retire and I'll just keep my drug coverage and my medical coverage through my employer. If you do that, then when you go to retire, you can utilize this special enrollment period, and the first of the following month of when you're losing that coverage, so say you're losing it January 31st, February 1st, you could have your coverage be effective for your Part A and B in your drug coverage, okay? You could also use what we call a guaranteed issue or GI period to get a Medicare supplement, a Medigap plan or a Medicare supplement, okay? So you can get that Medicare supplement effective 2/1 at the same time using a guaranteed issue period that applies to the Medigap plan as well without answering any health questions. Or you could answer health questions and get it if you were healthy and you didn't have to worry about that. But to use these, sometimes you have to have a letter from your employer or a letter from the health plan that you're leaving, saying when you're leaving it and giving you and granting you that guaranteed issue or special enrollment period. Let's see here. I know this is a lot of crap, for lack of a better term, that they put on here, but they have a lot of mess on here. Initial enrollment period, Medigap open enrollment, general enrollment, special enrollment, guaranteed issue, credible coverage, a lot of terms, and it almost seems like it becomes a full-time job for you guys to learn this stuff so that you can adequately make a decision. Well, honestly, there are a lot of brokerages, ourselves included, that can help you with that. You can call, get an experienced licensed agent on the phone that can answer those questions. We answer questions whether you're enrolling or not in a plan right now. We just want to earn your business by helping guide you. And these periods can be confusing. So I know I'm wearing a t-shirt, but it's T-shirt Friday here. But we are a professional organization and we'd love to help you with it. So if you could, if this video was helpful, please give it a thumbs up and subscribe to the channel. If you need further help, you can give us a call at 662-844-3300, or you can go over to our website, BobbyBrockInsurance.com, surf around the articles and videos on there. That's Bobby, B-O-B-B-Y, Brock, B-R-O-C-K, Insurance.com. And check it out, guys. All right, thanks. I know I've said it before, but please subscribe to the channel. Talk to you all soon.